All right, welcome to another episode of the Dr&Dr podcast. Today we have a very special guest. All of our guests are special, but this one is very special because she actually came from out of state and is pregnant with her second. And so it means a lot to us that you pulled out some time for us. Dr. Brook Choulet. Dr. Brook Choulet is a concierge sports and performance psychiatrist. So you're going to have to explain a little bit of that because that's pretty awesome. Sounds really cool. She's also the founder of Choulet Performance Psychiatry and president of the American Board of Sports and Performance Psychiatry. Thank you for coming.
Thank you for
She
having me.
also happens to be a cousin of Dr. K.
Yeah.
Okay.
I was going to say today it's actually Dr. and Dr. and Dr.
Yes.
Yeah.
Sometimes when I listen to recordings of me, I think it's you sometimes.
Yeah, this
I
is
don't know if
actually
that
going to be
happens
really
to you.
confusing because I have heard that too, that our voices are similar. So yeah, it'll be two of us and you.
Yeah. Yeah. And for anyone that's actually watching, these ladies are dressed up so nicely and they pulled me out of surgery to do this. So I have not the greatest look, but this is what it takes to be a real surgeon.
And running a business.
And running a business. And we'll tap into that too, because you do a lot of that. Well, let's go ahead and start. I mean, performance, you don't have to be in sports. You don't have to be, doing anything sports related, but you want to perform in life. And hair loss kind of comes into that too. So that's kind of, I want to touch a little bit on that. I'll probably let you take it away.
Yeah, I think let's start with, for people who don't know, just like what performance psychiatry means.
Mm-hmm. It's a good question because it didn't exist until we federally trademarked the term. But for me, like you said, I work with athletes and executives and working professionals, and sports psychiatry didn't really seem to capture that. And so when we think about, like you said, wanting to perform in every area of life, to me, performance psychiatry kind of is the future. Now we see performance physical therapists and even like performance scientists and pharmacists that are focusing on these niche areas. So to me, it's one, really defining what we do, but two, solidifying a brand and what we're known for.
Yeah, no, I think it's really cool that now that you've made it, it makes so much sense that it exists, but that it didn't exist until you made it exist.
Mhm.
So kind of this concept of psychiatry focused on enhancing performance. And as you said, that it doesn't have to just be work or sports, but in all aspects of life. But the reason I thought it would be interesting to have you on for our patients with hair loss or just individuals with hair loss is a lot of hair loss treatment comes down to being consistent with a routine. So I think something that a lot of people struggle with, especially at the beginning, is if they have patterned hair loss, which is a progressive form of hair loss, there's a lot that can be done, but they have to be consistent with it. So one of the biggest things that will determine how successful people will be beyond, like, if they respond to treatments, which some of that's biologic, but what comes into it even more than the biology of it, in my experience, is like, can they be consistent, not just for like a week or a month, but for years? Because as
Mhm.
soon as they stop taking treatment, their hair will go back to what it's programmed to do,
Yeah.
which is to thin. So that's why I thought it was a cool area to kind of go into, because I've never really thought of treating your hair loss as a something to perform in, but a lot of those same kind of concepts I think would apply in terms
Yeah.
of, you have to like have the motivation, you have to put in the work,
Mhm.
be consistent. So I guess that's a lot of things we can cover, but in
Yeah.
terms of like um habit formation and staying consistent with something long term, especially when it takes 6 months, like months and months to see results, what are your tips, I guess, for that?
Yeah, well, I think you touch on a lot of psychological barriers, right? Because you could have the exact treatment that someone needs to do, know exactly how to fix their issues. But if they're not motivated, or they might be motivated but have trouble sustaining change, it's
Mhm.
going to be a battle on both sides. They'll be frustrated and you'll be frustrated that there's no progress being made. And it's kind of a good analogy to the gym because for some people, they go into the new year, they're like, I want to lose 20 pounds and I'm going to go to the gym 5 times a week for an hour and a half each time. And
Mhm.
that's not an kind of integratable part of someone's life. You have
Mhm.
to integrate small habits in a way that you can be consistent. So
Mhm.
habit stacking is really a helpful tip because you essentially pair the new habit with something you do every day. So for some patients that might say like, "Oh, like I really want to take my medication, but I have trouble remembering it." You can kind of ask them, "What is something you do every day in the morning?" Like I
Mhm.
start my day with the same 3 steps regardless of where I am, what time it is. These are the first 3 steps I do. And so
Mhm.
how can we pair taking your medication with one of those 3? So habit stacking is really helpful. And
Yeah.
also I think the other psychological aspect is that if people aren't seeing progress, then it's hard to stay motivated to consistently make change.
Right.
So really having that kind of like therapy conversation with them in your office about, "Hey, like you seem less motivated than last time. I know this is frustrating. What do
Mhm.
you feel like you're stalling out on?" And get their input on how they think their progress
Yeah.
is.
No, that makes total sense. Like, it's interesting because for patterned hair loss, for example, there's so many different treatments, and sometimes people will ask me like, "What would you do?" And I'm like, "Well, I would do this and that
Mm,
this, but I really can't make that decision for you because like I can tell you this treatment is more likely to be more effective than this treatment, but
mhm,
if you don't feel comfortable with this thing and you're not actually going to do it, then please do what you feel comfortable with or what is doable with your lifestyle that you're
mhm.
actually going to do."
Right. Right, and as silly as this sounds, there's something called temptation bundling. I don't know if you've heard of that, but essentially pairing something with something that's pleasing afterwards. So as silly as this sounds, maybe if they have a case where they keep their hair loss medications, when they open it, having a picture of what they want their hair to look like on that
Oh,
pill case. And so it's temptation bundling where they're associating taking their medicine with that possible reward of looking like that after.
I've
Yeah, I
never heard
really
that
like that.
before. I haven't heard that term before. That's really cool. I don't know if this would it sounds like the temptation bundling is that always with um something that you want to become or achieve, or can it just be like a positive association in
It
general?
can be a positive
Okay.
association in general. So for people that don't like going to the gym, maybe pairing it with like getting your favorite smoothie afterwards,
Okay.
something that's an immediate reward. So I don't know, that's for you two to figure out what's immediately rewarding,
Yeah.
but having some sort of maybe like a reward system or some sort of a tracker that maybe even creating a mood board for patients of like, what do you want? Come to your consult with a mood board of what you want your hair to look like to really get them motivated and excited to possibly make that change.
Yeah, no, that's a really cool
Yeah,
concept.
very
I
cool.
I subconsciously did that with my prenatal, but it was also because it tasted disgusting. But I would like hold my nose, take my prenatal, and then put a tiny piece of chocolate in my mouth.
Yeah.
So when I opened my nose, I would just taste chocolate.
Uh-huh. That's temptation
Okay,
bundling.
there we
There
go.
you go.
And cognitive reframing can be helpful too, where instead of saying like I have to take this, reframing it as I get to take this and I'm going to look a certain way, or I don't know,
Mhm.
the medications are expensive, but rather I'm taking good care of myself. So reframing your thoughts in a positive way, which is hard because some people are glass half empty people. So you almost have to teach them to be glass half full.
Yeah, and when I
That's I do wanna double click on that. Go ahead,
yeah.
and then I'll
I try to emphasize that too, because I think the first visit, it's like a lot of shock for some people
Mhm.
that I'm telling them that they have this, long term progressive type of hair loss. And I'll say, like, treatments are long term, but now I don't even use the word long. I might say long term, but I clarify as in, like, you have to keep taking or doing whatever as long as you care about your hair. Cause sometimes people hear long term and they think it's just like, a year or 2 years or something like
yeah.
that, but I'll try to say, like, I know that's very difficult for some people to hear and accept, but the good thing is that we have all these treatments and these options versus, a couple decades ago, it was like Rogaine and that was it, and before that, it was like nothing.
Yeah. Yeah, I
So
say, I used to say, "These treatments are for life,"
Mhm.
and people would be scared. They're like, "Ugh, I don't wanna do
Mhm.
anything for life," right? Um, now I've kind of shifted it, and I said, "Give me 1 year of your time."
Oh,
Mhm.
you did the opposite shift as me. I went from saying long term to like making sure they know it's for life, and you went from like
Well, because I tell them,
You want the buy-in.
well,
Yeah.
I say exactly, like, "You care about this.
yeah.
Trust the process for a year, and then let's let the results speak for
Mhm.
Oh, that's
themselves."
smart. So
Right?
like just think about it, and then once they have the results at a year to kind of motivate them, then they
Right.
use that result
That
to
should be the
continue.
motivation, right? Like, trust me right now, but then trust the
Mhm.
process, right? Long term, and as like you said, as long as you care about your hair, then let's do it this way. But at the same time, like, if you want to be flexible, you want to
Mm.
change it up for yourself, we can. There's no one size
Uh-huh.
fits all, right? But I did want to double click on one of the things you had mentioned. It's like, what kind of framework do you recommend for hair loss patients or anyone really
Mhm.
to take? Because I think we think of um, activities that we do, like go to the gym
Mhm.
or go to therapy or eat well or whatever. We're looking for a positive gain,
Mhm.
right? One of the hard things in hair loss that people have a hard time grasping is maintenance.
Mhm.
Like, maintaining what you have is actually a positive win. Because if you don't do something, it's going to get worse,
Right.
right? With time, you're going to lose more hair. And so sometimes they feel defeated that whatever they're doing, it didn't lead to that gain.
Mhm.
But in our eyes, it's like, well, it could be a lot worse.
Right.
So, I mean, what would you say on that?
I think expectation setting, which I'm sure you both do, is really important. And I like what you two just said about how you approach your patients. And I might even take an even like shorter term approach with it and just say, the really exciting thing about taking these medications is as long as you keep taking them, you'll continue to see results
Mhm.
and almost leave it at that. And then if someone says, well, is this going to be lifelong? Then that's the time to jump in and be like, yeah, the great news is as long as you keep taking them, it'll keep
Yeah, that's a
working.
very positive way of saying it.
Yeah.
Yeah, because the way you frame it for them is also important to set up those
True.
expectations and not have it be a negative frame of like, well, this is something you have to take forever, which I know you're trying to warn them, right? And almost do that warning shot that we're taught in med school.
Yeah.
But at the same time, a lot of people that come in the door are coming in for hope, right? They want to feel good leaving, and that might make them feel hopeful. Just that simple wording change, even though you're doing the same thing and you're saying the
Right.
same thing, but it's just with that approach of this is really good news that you will continue to make and maintain progress as long as you're, taking these medications. So then with your question, I would almost, I know it takes longer, right? And like you guys are so busy and moving through the day, but almost taking that extra moment to ask, like, what are your expectations from this treatment? And almost like super open ended so that you can gauge what those expectations are and then take
Mhm.
that time to reset so that I always use the phrase expectations a dirty word and that we shouldn't have that in life in general.
Mhm.
So then just saying, like what would make you feel good about your progress in treatment and really like jotting that down to make sure you can address that in the future.
Mhm.
So we actually part of our whole process is like during every consultation, we have our medical assistants ask them what, and it's in our paperwork too, what their goals are.
Mhm.
That's always helpful because like some people will be like, I want to regrow all my hair, or
Yeah.
some people will say like, I just want to keep my hair from getting worse.
Mhm.
So it's kind of helpful to know going in what they think is success.
Mhm. And
Because
realistic.
right,
Yeah.
because like what you're saying is like, um, and I break it down. I'll say like there's, different outcomes of treatment. So the first goal of treatment would be to stop or at least decrease progression. So like keep
Mhm.
it from getting worse. The second goal is to like thicken the hair that you have. And the third goal, which is the least predictable, is actually growing more hair. This is about non-surgical treatment for
Mhm.
patterned hair loss. But I always like to start with just setting out that and making it very clear that, keeping hair loss from progressing or minimizing how much it progresses over time is a positive treatment outcome in case
Mhm.
that they haven't thought about it in that way.
Mhm.
Some people come in thinking about it that way, but some people come in thinking like they want to, you know, um, grow a bunch of hair, which might not be realistic in their case, or I just don't know how they're going to respond.
Right.
Um,
Yeah, I kind of play on that too. I say, you know, starting the journey, even with medications,
Mhm.
at least gives you a little bit more control back. Because right now everything is chaos. You don't control anything as far as hair loss goes. It's gonna keep progressing. At least this will buy you some time to decide and decipher what's right for you, what's not right for you. And
Yeah,
I
and
think
I
that gives
like
a lot of
that.
folks confidence. It's like, all right, I'm gaining control again over the situation.
Right, because you're right, control is a big thing that people don't have when they come in. They feel
mhm.
like whether they're losing hair or getting hair in new places, that it's just not in they're just not in control of that, right? And then that's a psychological barrier now to treatment at times is how I feel hopeless, and then trying to take medication consistently is just even harder because then there is a fear of what if it doesn't work, and then people
Right.
jump down that worst case scenario rabbit hole before they even start treatment.
Right.
I'm sure you get that too. Like, well, what
Yeah.
if this doesn't work?
Yeah, and I think people put that's a great point, is people put a lot of pressure on themselves. I'll see sometimes when I go I'm trying to be helpful and going through all their options, and some people I'll see just become, like, paralyzed because it's like they're putting all this pressure on themselves of they don't know what to do and what they're gonna respond to, and they don't know what they're gonna respond to, and should they what if it doesn't work? And so I try to take some of that pressure off of,
Mm,
like, I want you to start with what you're comfortable with because, again, like, you're gonna have to be consistent with it. And then the important part is that you come back in 6 months because at 6 months, usually we'll have it's not the full result, but we'll have an idea of what direction we're moving in. And if we don't get it right this first time, we can adjust. So, we don't, and I'll even say you don't have to get it right now, as long as
yeah.
you come back and we can make adjustments, like we can figure it out. So trying to take some of that pressure, which for some people truly I can like see it in their eyes as like paralyzing.
Mhm.
Um
And a lot of people do have anxiety, whether it's clinical anxiety, clinical level, or just kind of some general anxiety.
mhm.
And so, one in cognitive behavioral therapy, we call it thinking errors, but one thinking error that a lot of people have is almost catastrophizing. So,
Mhm.
it's like, oh, I'm starting to lose hair postpartum, you and I know,
Mhm.
but starting to lose hair. And it's like, I'm going to lose all my hair. I'm never going to look the same again. My hair is never going to be the same again.
Mhm.
And one thing that can be helpful in those moments when you can start to pick up that catastrophic thinking is going down what we call like a worst case scenario or a downward thinking arrow technique of, well, what's your worst fear? And then they might say like, well, I'm going to be bald. And then that's when you could come in and be like, well, what do the likelihood of that? What do you actually think the likelihood of that is? Because right now I know you just had this baby and I know we can see some hair loss, but what do you think the actual likelihood is of you going bald? And then they'll probably say like, well, I don't know, not very much. And so that's how you can pull someone out of that catastrophic thinking is
Mhm.
by testing the logic behind thoughts. So that's like kind of deep in the CBT world, but that I'm sure you hear that kind of catastrophic thinking at times is,
Yeah.
that worst case scenario.
Yeah, no,
Yeah, and
absolutely.
and a lot of times they won't even like mention it,
Mhm.
right? But they'll be
Thinking
ruminating,
it. Yeah.
especially outside. So like we had a we had a patient, your patient, that actually recently the mom called Dr. K and was saying, she's tried everything. Patient's tried everything, possibly wants to, trim all of her hair off,
Mm.
shave it off. And so we gave her some alternatives and, a stopgap. And I did scalp micropigmentation to cover up some scalp. And I think she's happy with it. And, we, we see what the next step brings. But
Mhm.
yeah, I think bringing it to surface is smart. It's nice.
Mm. Yeah, because that is an example of catastrophic thinking, right? And
Mhm.
then acting
Acting.
because you feel like you don't have any control.
Yeah, that's basically what they were trying to do, just take control of that
Mhm,
situation. Um, but yeah, I think for us, like the 6-month follow-up is a lot about just showing results to keep people motivated
mhm,
because once they see a result, if there is one, that's very motivating to keep going. Um, but I guess do you have other tips? You mentioned maybe like having like a mood board, or having photos of what you want your hair to look like,
mhm.
but anything else you would recommend for people just trying to um maintain hope, especially maybe at the beginning of the journey when it's a little
Mhm.
harder?
Yeah, I don't know if these are things that you do, but even if you recommend certain shampoos or conditioners or different vitamins and supplements,
Mhm.
kind of checking in on how were you able to build this into your routine and almost circling back because then patients feel really heard too. You get that sense that, oh, this one thing I mentioned or this one thing we talked about 6 months ago, my doctor did remember and brought up with me. So I think just even from a psychological standpoint, checking in on those small things or revisiting, I know your goals last time were this. How do you feel like we're making progress? Really makes a big difference in the therapeutic rapport too.
Yeah. Um, but I mean, I guess for patients like at home, but they um see us and then they're going to come back in 6
Mm,
months, but they go home, maybe they feel overwhelmed or maybe they start treatment. What'll happen a lot
yeah.
of times is they'll start treatment for let's say a couple weeks, maybe 2-3 months. Um it doesn't happen as much with our practice because we're pretty good about counseling on expectations of timeline, but it's super common that people will actually come to me saying, "Well, I tried this and it didn't
Hmm.
work." But then when we go through the timeline, it's like, "Well, I did this for 2 months. I
Right.
did this for 2 months." And it's like we counsel, "Well, it actually takes 6 months. So the
Hmm.
fact that you didn't respond after 2 months doesn't mean you won't respond." But I
Hmm.
guess for people at home, either after seeing someone or, maybe they decided to pick up minoxidil like Rogaine themselves and starting that, besides having realistic expectations of timeline, how do they stay motivated with like
Hmm.
staying consistent with it? I
It's
think it
tough.
I know I kind of already asked you this, but it's like people just struggle with it so much.
Yeah, it's tough because, like you said, you can't make a decision for someone else. People have to be so intrinsically motivated. And I think that's the hard part as physicians, right? Is we care so much about our patients and we want to see them make change. But if someone's not willing and able to make that change and sustain change, there's only so much we can do. But on the patient side of things at home, things you could do are like keeping those reminders of why you're doing this
Mhm.
and marking small wins along the way. So
Mhm.
like, yes, I was consistent for 30 days with this medication and now I get to do it for another 30. Like I think people really struggle in today's society with celebrating small achievements. People just see the big ones on social
Mhm.
media and it's like, "Yay, I regrew all of my hair 80%." But I
Right.
think really like small wins might be, okay, I'm not seeing as much hair falling off on my brush as I used to.
Right.
But people sometimes don't see that as a win. They just want that growth back. So really like people need to be accountable to themselves and have sustained change. And I'm big on analogies. So I use the gym analogy all the time. It's like, would you expect to go to the gym for 1 month and look like a bodybuilder?
Right.
No. Those people that you see that look like that have taken years to build their routines, change their diet, and overhaul their whole lifestyle.
Mhm.
And so I'm sure you make dietary recommendations or supplement recommendations, and it's like this whole person approach rather than just take your medicine and you're gonna get better. And so I think people really like have to be accountable to themselves and acknowledging what their role is because yeah, like you said, you're seeing them 6 months later and everything in between is on them. So I think it
Mhm.
does take a lot of self-awareness to
Yeah.
really sustain change.
Yeah. But I have some people where I think I'm just they come back to me and I kind of wonder why they came back because they didn't do anything. Like
Hmm.
they come back for their follow-up and they didn't choose to do anything. But I think they come back probably again just for
They think you're the captain of their ship. I think
Yeah.
that's a lot of patients. They want you to take responsibility and accountability. And it's you're like, I don't know, the Coast Guard that's like radioing into them,
Yeah.
telling them how to navigate the waters, right? They have to take accountability and really captain their own ship.
Yeah.
It's quite interesting. I mean, I want to expand the scope a little bit outside of hair, but I totally think it's related. As our world keeps progressing and we're getting more knowledge, and technology is advancing, I think humans in general, is at least in the Western world, definitely in the U.S., possibly Europe, have become very, very interested in wellness,
Mhm.
of self, of body, of mind, right? Um, And I think that goes hand in hand with taking care of yourself, optimizing yourself. And one of the things that will be an end result is, if you want to, tangentially apply it to hair, is your hair will get better, at
Mhm.
least better than if you're having bad habits like poor sleep or alcohol or diet.
Mm.
Um, can you explain some of your work in performing or performance psychiatry to optimize self with that?
Yeah, I think a lot of people, whether they're working professionals and employees, whether they're leading a company, founding a business, all those different things take a lot of mental fortitude. And mental fitness is something that can be developed just like physical fitness, where you have to stay calm under pressure, be focused and clear in making decisions, stay really grounded and emotionally non-reactive when shit hits the fan. Like all these different things, you can't just be a good leader anymore and good at your job, right? Because in order to be a good leader, people have to want to follow you, and not because everyone's getting paid by you because they're an employee, right? And so in these
Mhm.
large companies, I think a lot of people still get by not being mentally fit because there's just a control dynamic. But I think more and more people are fed up with that. They want to feel well. They want to be their best self. They want to have all these physical and cognitive traits to make them a better person. And so, really, with performance psychiatry, we're taking a look at like all the nitty gritty of how do you communicate in your day to day with your spouse or with employees? How do you manage tasks? Like how's your email inbox look? All these things are different indications of habits and the way that people deal with things. And, I love diving into all those small minutia of someone's day to day life because really it does give you a glimpse into how they are functioning and operating from a
Mhm.
cognitive standpoint. And the way I describe it is like we all pay for a certain amount of internet speed, and our brains can only work at so much capacity, right? And so if we're wasting it with angry thoughts or being upset or mad or anxious and all these non productive thoughts, then how much bandwidth do you really have to think productively and perform at your best in all these different areas? So
Mhm.
I really like diving into the person that exteriorly, right, seems like an amazing leader, or people think they are a certain way,
Mhm.
but then navigating some of the intricacies of, I don't know, what's going on the inside.
That's so interesting though that you bring that up. Like, to be the best version of yourself, you're saying that, focus your efforts, your energy on things that have an ROI, right? Some sort of return on investment. But at the same time, I think you probably have some advice as to not blunt those other feelings, right?
Mhm.
Anxiety or anger or whatever. How do you have your patients shift that focus? Like, do you have protected time, right? Where you
Huh.
focus on that instead, and then, you come back? Like, there has to be a sense of realism, right?
Right.
To a person to also address those feelings.
Yeah, so the best way to describe it, again, another analogy is like if you're moving on the bullet train, right? You're all the scenery you're going by is going by very quickly. Nothing's sticking around for long, like if you're at a
Mm.
stop. And so I hate overused terms, but the best word for this, when you think about its true definition, is practicing emotions mindfully. So if someone is feeling anxious, right? Because that happens and it's natural and it's normal, you can observe that it's happening and not react to it. So it's like you're on the bullet train moving and you're noticing that you're anxious and you're letting it go by. It's not sticking to you like if you were at that stop and you're just ruminating on it.
Mhm.
And then another strategy too is then I encourage my really high functioning patients to categorize their anxieties as productive or non productive worry. So a productive worry is something you can actually do something about. So I'm nervous for my board exam. Well, you can actually convert that into a study plan and it's actionable. So again, you're moving past that feeling of feeling anxious and you're doing something about it. A non productive worry is like I had an argument with an employee today, or I had a disagreement with a colleague. Well, if you spend an hour thinking about that or 10 hours thinking about that, you're not resolving anything with that rumination. So that's a non-productive worry. So really trying to encourage people to categorize their worries because so many of us that are high performing and managing a lot of things, we can logically bring that self-awareness and start to analyze our thoughts.
Mm.
And that's really what I encourage people to do is, yes, recognize these emotions, but you're not getting stuck in them. You're moving past them.
I have another follow-up. Like,
Yeah.
this is so interesting to me, but I don't want to like.
No, you're good.
Okay, I want to
Yeah.
ask more
Yeah,
questions.
please.
Like, there's a book by the founder of Shake Shack, the
Mhm.
restaurant chain, and I think it's up in Madison Park, and I'm forgetting his name, but the book is called Setting the Table. And in it, he talks about how he started his business and had to deal with, systems and creations and things like that. And things that used to frustrate him a lot then became part of the journey and he became passionate and happy with it. So one of the things with setting the table is he gives an analogy is like someone is going to move the salt shaker and the pepper thing to the side of the table. And all you have to do is you have to just put it back in the middle,
Mhm.
put a smile on your face, and it's going to happen again. Do that. And I think in my journey as an entrepreneur, um, over the last 3.5 years, there have been a lot of frustrating times because you want to try to be perfect
Mhm.
every time. I mean, going through medical school, training, you're a physician, right? And you expect the whole system to run perfectly. And so I think a level of performance has to deal with happiness.
Mhm.
So do you have a way to tell patients or tell clients or whatever, um, you know, this process itself can be enjoyable if you look at it
Mhm.
from 10,000 feet as opposed to being in the trees.
Uh-huh.
Does that
Yeah.
make sense?
Oh, yeah, absolutely. I have that discussion all the time. I got into an argument with one of my favorite patients who was saying, well, if I'm happy with where I'm at now, I can never have goals for the future. And I'm like, that's actually wrong. Let me correct you. So what I love to ask every one of my patients is how do you define success? And a lot of them like have to think about it for a minute and they're like, I actually don't know how to answer that question. So we kind of work through that and we finally get them to an answer. And I'm like, so is it fair, whether it's, freedom of time, autonomy, a certain number, is it fair to say you've reached success? And then you see their face and they're like, oh yeah. I'm like, so is it fair to say you can be happy and fulfilled? Because I think the word fulfillment's really important. We're all aspiring to do things and the bar should always be moving, but like we shouldn't tie our happiness and fulfillment to that moving bar because
Mhm.
otherwise you're going to forever be chasing it and not be happy in the present moment. So that's what I really encourage people to work to is how can you be truly happy today yet have goals that you're striving for that are actionable and that are pretty objective because if you tell me I don't know what success looks like to me then how do you ever feel like you've achieved that? So yeah, I think that's a great question because it comes up all the time and there should be a disentanglement between happiness and fulfillment today and still working on that entrepreneurial journey and moving towards a goal.
Yeah, I really like your mindset on that. That like fulfillment puts some sort of emphasis on the present and now
Mhm.
and yes, everything can be better, right?
Yeah.
But like we always talk about it, we're like, well, look at people in this part of the world and that part of
Uh,
the world, and it's so foreign to us because we don't necessarily deal with it besides seeing it on like Twitter
mhm.
or the news or whatever. But being fulfilled with what you have right now is awesome, and you can still have goals to better yourself and work towards.
Yeah.
And yeah,
And
I like that.
comparison's so dangerous too, right? Because as soon as you start to feel
Mhm.
yourself and social media is terrible for this. I'll ask people, "How do you feel when you open Instagram?" And some people say, "Oh, I feel great. It's like cute animals or videos." But some people will say like, "Oh, it makes me feel horrible. I see all
Yeah.
these people that have these things," or that's the perception, right?
Hmm.
And so I think it's so important to be happy and try as hard as you can to walk through life with like in that I don't know if anyone watches Seinfeld, but in like the bubble boy suit where it's like no matter what's going on outside of you, you're not impacted by that. And this is the hardest assignment I give to patients, but telling them not to let positive feedback or negative criticism impact their self-worth. And people are like, "Oh,
That's
well,
hard.
that's
Yeah.
kinda easy with the negative feedback, like, I just know that it doesn't matter, but you're telling me I can't, like, feel better about myself with positive feedback?" And I'm like, no, because it's still an external validation. We were just talking earlier about
Mm.
needing external validation. You shouldn't. You should be totally so self-assured that positive feedback or negative criticism does not waver your level of self-worth.
Yeah. Yeah. Oh, that's awesome.
Kind of goes with like stoicism and all of that, that
Yeah.
you're not responsible for the external world. You
Mhm.
are responsible for yourself, and your actions. And as long as you're doing good and, obtain like not obtaining, maintaining like a high level of morality,
Yeah.
that's all you need to do.
Yeah.
Um,
You never want to let external forces like
but it's
kind of
really
dictate.
hard.
It is hard.
Yeah.
But
I
once
think,
you become aware of it, then you can like have that self-awareness and the reminder not
yeah,
to.
I think especially like in healthcare or any type of industry where I wouldn't even say industry, like a calling where you are helping and healing
Mhm.
people. Obviously, you care about people, which is why you went into that. So that is something that I definitely still, I've been through therapy, I've worked through a lot of things, but I think something I still struggle with is like I get so happy when a patient is happy,
Mhm.
and I am so upset if I don't achieve an outcome for someone that I don't want, or even if a
It,
staff member is not super happy, it affects me. I
I,
want to make everyone happy.
since I work with you and I am married to you, I see, let's say, my point of view on this. I think when patients are happy, you let that kind of dictate your feelings for a fraction of the moment
Mhm.
compared to when
That is true.
someone is upset or negative, right?
Yeah,
And
Mhm.
you let that linger a lot
that is
more,
true. When you
Yeah.
should probably,
right? And I think this is probably true for a lot of people. Definitely, I think all of us. Sports reference here: Kobe Bryant,
Mhm.
R.I.P.
Mm.
So he was asked. I'm loosely saying this, but basically, well, what do you think when fans are upset with how you play, or you don't do so well? And he kind of scoffs at that question. He's like, I'm gonna be much more tough on myself than any fan,
Yeah.
period. And so I think as a physician, we're all wanting to be the best also for ourselves. Like there's a reason why we did this as opposed to something
Mhm.
else. But having that framework to I'm terrible at this too, but like thinking, big picture is like really important at time.
yeah,
Mhm.
no, and the forum, the ISHRS forum that I'm co-editor for, Dr. Guillermo Guerrero did like a piece actually on it in a literature review where he normally we review articles and he reviewed like stoicism, which got
Mm.
me like into that. And I read a couple books on it. But he was basically saying like it's not like you wouldn't feel negative if you have like a negative outcome, like a surgical outcome or something, the outcome that you don't want, but really you should just look at it like objectively and not become reactive to it.
Mhm.
And basically, like, is there something you can do for that individual? Yes or no? Is there something to learn from the situation? Yes or no? And then that's it. Like, what else are you supposed to
Right.
do?
Yeah, that's
Um,
essentially the productive versus unproductive anxiety, right? Is
right,
there something you can do with this worry,
right,
or do you just kind of have to move on? And it doesn't mean you don't care, right? Because that's the other thing is if people worry that, well, if I don't think about it, it means I don't care. It's not true. You're just protecting yourself from that reactivity because
right.
reactivity is like the quickest. I call it like a virus in the workplace, right? You could have one employee or one physician that's so reactive that it
Yeah,
causes such a situation, right? And so just if you can, I think that's one of the good qualities of being a good leader is that stoicism,
yeah,
right? Where it's like you still have thoughts and feelings and emotions, but it's not externally conveyed. And then you work towards a place where it's not really internally preoccupying either.
But it's easy for us to say this right now because we're, let's say, retrospective and
Mhm.
analyzing situations we've been in. When you're in that moment, you're like, no, like I'm pissed, right? Or like I'm upset.
Uh-huh.
What are some tips and tricks you can recommend to like snap out of it for a moment, even, right?
Yeah.
To give perspective.
Well, that's kind of developing self-awareness, right? Because a lot of people, I always joke, if someone is the type of person that goes on an apology tour, right? So like they mess up, they yell at someone, then they have to go apologize to a bunch of people. But if you can become so self-aware that in that moment you're feeling a certain way, then you can help kind of mitigate that reactivity in the moment. So that's a part of performance psychiatry, right? Is like really developing resilience, non-reactivity, and being emotionally grounded to where then you're not reacting in those situations. So an example might be, I always ask people, we all have some sort of a physical sensation we feel when we start to get anxious or
Mhm.
angry. So some people like will describe the back of their neck feels hot, or their hands start shaking, or their stomach feels queasy. So finding out what that is for you, reflecting on that, and then training yourself almost like, Pavlov's dog, that once
Right.
you notice that, you go into the logical mind rather than the emotional. So, okay, I know I'm about to start kind of feeling a certain way. So I'm going to just take a moment, and whether it's like sending an email, right? I'm going to take a moment and not hit send right now. I'm going to reread this in an hour.
Schedule send.
Yeah, exactly. Exactly. And just taking a moment to pause before going to fix a problem. Because a lot of people with anxiety will feel like they need to fix something immediately, especially high performing, like high functioning anxiety. It's like I have to fix this immediately so I can feel better.
Mhm.
But that's almost like encountering OCD level, right? It's like the obsession is the worry and the compulsion is to resolve it so that you don't have to sit with the discomfort. So
Mhm.
that is also something to just through developing self-awareness of how you feel, help mitigate some of those issues down the line.
Beyond kind of awareness, emotions run through every event in life, right?
Mhm.
And they're maximized with other human interactions. And I
Toddlers.
right, exactly.
Yeah.
And it can be at home, it can be at the
Mhm.
workplace, it can be in a relationship. Um, what are some things that you recommend? I'm assuming my mindset, which is um, peak performance,
Mhm.
right? You don't dwell on the emotions and the energy it takes. We kind of touched upon
Mhm.
that, but really whatever you're trying to do,
Mhm.
right? And so if I could be a robot, it would be perfect. I'd be like even more successful, right? Um, in that I'm not letting these things drag me down,
Mhm.
right? What do you tell your patients, your clients, like, hey, you want to optimize your, you know, teamwork,
Mhm.
whether it's sports, you're a high level executive, etc., or just better the work you put out? What are some things that they can do that we can do
Mhm.
to
It's
kind of take control?
it's so individualized. Like I will go through a whole assessment of asking people like about their inner workings, because for some people it is like, hey, you're actually functioning too much like a robot, and when you get home you're like barking the same orders that you were at work, but that's not going to work in the home environment. And like asking a high, functioning surgeon, I've seen plenty of those, like plastics or general, of like, hey, do you have feelings? And they're like, I don't have feelings. That's a waste of time. And it's like, no, no, no. Let's actually revisit that. So for every person, it's so different, because some people might be sitting too much in their feelings and they need to be more in that logical mind. And then some the opposite. It's like, well, everyone at home thinks you're a robot too because you're not sharing your emotions. And I think that there has to be a balance, or like that perfect mix of being really logical, but also exhibiting emotions and compassion. Because I know
Mhm.
you mentioned like doing what we're supposed to do. So at home, for example, we both have toddlers. That is patience. That is like showing compassion. That is being, taking extra time that seems like a waste of time to help explain something. So I think we really have to be cognizant of the environment we're in, and then what's appropriate for that environment, and move from there. Because I think a lot of people too, they just want to figure out one thing and apply it to all areas of life,
Right.
but you have
Yeah.
to be flexible in terms of knowing how to act in certain environments.
Yeah, no, I think that's a great point. Is I think we think of ourselves as if this works in one context, it works in a different
Mhm.
context. But you're saying it not only depends on the individual, but also one individual can depend on,
The
different
environment.
aspects of environment.
Mhm.
Um, but yeah, you also had said something about earlier. I wanted to talk about that a little bit more. You had said something about basically that not worrying about something doesn't mean you don't care.
Hmm.
And I think that's like a very important thing, at least for me, to internalize. And I would assume for other people too, is like actually, if you're not giving all this energy to worrying about something that has already either happened or is not in your control or whatever it may be, that then you can have more energy and hold more space and give more
Hmm.
um, to situations and people where you can actually be helpful. Um, but I think like I don't know. I don't know if you struggle with that, but for me, it's like I just care so much, and to me, somehow, like my mind, like caring means worrying. So I don't know. I thought
Yeah.
that was really
Yeah.
interesting to point out is that worrying actually is not
Doesn't mean that you
caring, and
care more.
it doesn't
Yeah.
help at all.
Right.
If you were to, and that's what Guillermo kind of went into too. It's like if you are able to stay really calm and not reactive, then you're actually maybe able to help that individual better.
Yeah. And a
Um,
good example is like a one-star review on Google, right? Like you might have cared so much about that patient and tried so hard to help them, and then they weren't happy with whatever it was from their perspective, right? Because we all come to things with our own perspective,
mhm,
that then it probably feels productive to worry about what went wrong.
mhm,
And it almost probably seems like a root cause analysis. You're like, well, if I just think about this like 30 minutes more, an hour more, maybe I could figure it out.
mhm,
So by not thinking about it, you get that perception that maybe I don't care, right? But like you said, it's holding space to do other things that are more productive. So maybe that specific thing doesn't happen again, or just even detaching from, okay, that made me feel really frustrated because I tried really hard and I did put in my best effort, but there's nothing else I could have done, so I have to move on.
yeah,
But it's really tough.
What do you recommend to folks? You lose a string of basketball games, or you
Mhm.
have 4 games, or you're a stock trader and you have a bunch of losses. Just like a repeat over and over. Um, it's hard to brush off.
Yeah.
What's your recommendation? Like step away for a little bit. Like what would you say?
Well, again, those are jumping to like a resolution before figuring out what's the underlying cause of those emotions. So with a lot of people, they tie their self-worth to like their contract, right? Like if I don't play well, I'm not going to get a good contract, and that means I'm not a good player, and that means that I'm not as good as everyone else. And that means I'm never going to be good enough. That's kind of like the downward
Yeah.
thought process. Same with stock traders. It's like, well, my portfolio is a representation of my worth, right? That is, I'm doing great. So I'm a worthy person. Like nothing bad should happen to me. So then when your identity is so tied to whatever that kind of line item is, or that value is, then when things get derailed, it's really hard. So I almost proactively encourage people to build in other parts of their identity when things are going well. So when athletes are healthy,
mm,
I talk to them about, well, what if there are 8 slices of a pie, how many slices are your sport in terms of your identity? Like, if you're a business owner, how many slices of your 8 slices are your business?
mhm,
Because then if you get injured or you get traded or you're waived or your business fails, it's so easy then to become clinically depressed, become clinically anxious, and really feel like you are not a worthy person anymore.
mhm.
So I whenever someone comes to me with a thought, right, I always try and zoom out and figure out, well, what's that underlying core belief that's really leading them to have that thought in that moment.
It's also interesting that, I mean, it makes sense, but it's smart that you're focusing on the other things actually when they're doing well, so that they are aware and have some identity in other aspects of their life
Mhm.
developed, while they're at their kind of high and peak.
Yeah, because
Um,
even like transition to parenthood, right? If your whole identity, if all 8 slices are work, then you're gonna have a really hard time when you transition to having a child, right? Or getting married. Right now, it's like, oh, I have this spouse I have to take care of, or all there. It almost feels like there's no room for other pieces, and so
mhm,
people really have to be self aware and cognizant of like taking inventory of how they're identifying their self and how they're allocating and prioritizing their time.
Yeah.
How does sleep play into everything, right? I mean, I'm hearing so much about I wear a Whoop band,
Mhm.
and it tells me I'm constantly getting poor sleep now. So I have a toddler. It's so sad. It's like I'm 37 at the time of this shooting, and it says I'm on my health. I'm actually older than my chronological age. And that was so disheartening to see.
Yeah.
But at the same time, it also prompted me to say, okay, yeah, I need to take
Mhm.
control of this. Where does sleep fall into performance?
Yeah, it's everything, right? And so I tell athletes who they're like, "Oh, well, if I just stay up one more hour and watch an hour more of film, or if I'm a business owner and I just stay up one more hour and work another hour, it's going to make this percentage of a difference, right? It's going to move the needle this much." But when you can start to reframe sleep and rest as actually productive to your performance, actually enhancing your performance, everything changes. So there was a study out of Stanford that they looked at like 112 athletes, and those who got less than 8 hours of sleep a night had a 65% increased risk of physical injury.
Oh, wow.
Oof.
That's significant, right? And so when I talk to athletes about, well, what's your worst fear? Oh, I'm going to get injured this season. Well, let me talk to you about how important your sleep is. And same on the cognition side, too, right? That's
Mhm.
when we're consolidating memories and getting rest and actually building up to being awake the next day to perform again at a high level. And we've all had those nights when we had newborns when you wake up and you're just like, is this even reality? I don't
Mhm.
even feel like I'm a human right now. And you start to almost dissociate a little. So
Mhm.
that's like the extreme, right, of what poor sleep does.
Right.
So I always ask people, well, what are you doing in that last hour before you go to bed that you feel like is so important that you need to do that rather than sleep? And we start there.
Yeah, this is great.
Yeah, no, I think this was really great. Um, it's interesting how you would I don't know. In my current view, it makes sense that all these things are part of performance psychiatry, but like I feel like in the 1990s, performance psychiatry would be like have more discipline and work more and
Suck
wake
it
up an
up.
hour earlier and like just power through. And but I think your approach to it is, very like holistic. Um and really honoring the person and finding their value even outside of whatever arena they're performing in, and probably that helps take pressure off of them and they're even able to perform better. So
Yeah.
it's a really nice holistic approach. I think in general for everyone, all humans, even if they're not an athlete or a CEO or a surgeon. um, but I think we also went through a lot of things that are helpful for people with hair loss in terms of trying to form habits, stay consistent, have hope. Um, our last guest had a really entertaining thoughts on hope, but I think hope is sometimes really hard to achieve. So I guess one final question, and we can call it unless anyone has anything else. Um, but do you have any? We talked a lot about like visualizing and having those visuals to motivate. But anything in
Mm,
particular in regards to having hope, even when
yeah.
things are really bad? I guess.
I guess like my gut reaction is to cringe a little bit at the word hope because it's so unactionable.
Yeah.
And I'm all about like actionable steps, right? And so hope is a great thought, right? That's a great emotion. But if I were in my office, I could see myself saying to the person across from me, well, what are you actually doing about it? So I'm all about creating actionable steps. Hope is great, but what are you looking to achieve? Let's first outline that and then break it down into actionable steps to achieve that. Because then we could convert your hope into
Yeah.
actual
No, I like that,
fulfilling.
and that's
I like
actually,
it.
like,
Hope is action.
doable and realistic versus
Right.
probably it's also, like, a lot of pressure on yourself to feel this hope.
Yeah. Cause to me,
Um
hope is inaction. It's like, well, I hope my hair grows back. And it's like, well, I hope so too. But I guess we're leaving this not doing anything about it.
Yeah. No, I like that. So, I think that's also, like, sometimes something that people are waiting for. It's kinda like when you in the fitness community, there's, like, this big thing about, like, just getting up and doing it and not
Mhm.
focusing on having the motivation. Like if you're waiting for the motivation, it's not going to happen. You just have to do it.
Mhm.
So kind of like a similar concept there, I guess, of where you're like, what do you want to do? And let's do it.
Exactly.
Instead of like, where is my motivation? Where is my hope? It's
Yeah.
more start with the action, and then sometimes the mental part of it will come.
Mhm. It
Uh,
applies in business too. Like I'll hear all the time of, "Oh, well, I want to start my own business or I want to start my own private practice." And a year later, they're still fumbling over the wording of their website and
yeah.
so stuck in inaction and indecision. The best kind of entrepreneurial like influencers out there just say, just do something because you're going to fail a million times.
Right.
But if you can just keep making decisions, you're going to figure something out.
Yeah,
And you learn every
we have
time.
the
Yeah.
80-20 rule. It's not novel, not created by us or anything. It's like work on something. Once it's at 80%,
Mhm.
launch it.
Yes.
Let 20% be dictated by the market forces,
Mhm.
right? By the world. And then you're gonna refine it. And if you kind of try to do that with everything, you're gonna end up keeping on
Mhm.
progressing. And the
Well, it's
educational feedback you
yeah,
get
it's the
is going to
same.
make
It's
it
the
better.
same thing we've been talking about. It's like being attached to an outcome, being attached to perfection, and you actually need to detach from that and just
Mhm.
focus on the present and what you need to
Yeah.
do. Have, goals, and not like you're not forward thinking, but you also need to just like do what you can in that
Mhm.
moment and keep going and keep
Yeah.
learning and growing and progressing.
And be happy while doing it.
Yes.
There you go.
Be fulfilled.
And on that note, we will
So,
try to feel fulfilled. And
yes.
I think there's a lot of good to take in from this. I think I'm going to absolutely have a lot of follow-up questions with you offline to better myself and achieve peakness.
Peak performance in
Peak
every aspect
performance.
of life.
But I wanted to say thank you to Dr. Brooke Choulet.
Thank
Okay.
you.
Um, we're going to have your information, within our taglines below so folks can find you. And it's been a pleasure.
Thank
Thank you
you.
guys so much.
See, we're definitely related. Said thank you at the same time.
There you go. Thank you. For Dr. Kash, I'm Dr. Roopani, and this has been another fantastic episode of Dr. and Doctor. Until next time.
And doctor.
And Doctor.